about HPLC. So this slide is taken from the lecture of the college. So first of all, a 3 years old boy presents with A and E, I mean emergency and emergency department, with severe pain. Based on his family history, hemoglobin profiling was requested. So what are the relative level of the major hemoglobin type? So you should know the norm here in this slide. So here you can see the hemoglobin F is becoming 25. Hemoglobin A2 is very low, and this is hemoglobin S, okay, which is high. What is your diagnosis for this condition? If you are having a very high hemoglobin S, you are having very high F, there is no A. So what is it trait or it is affected? It is affected. Why? Because there is no A. Why we are using hydroxyurea for this condition? It is a pharmacology because it's increased hemoglobin F. Then, during a premarital blood testing of a 24-year-old woman, the following hemoglobin was obtained, and it's very clear that she's having what? What are the estimated, first of all, number of them? Okay, this is easy, but you can see hemoglobin F is low, but hemoglobin A2 is also normal. Hemoglobin F is slightly high. What is the hemoglobinopathy in this individual? Because we are having hemoglobin A and S together, what you will say? It is the trait, okay? And assuming that the groom has a similar, how much chance she will give it for the offspring? So you will do the Punnett square. You will say that you are having A, and A. So how many of the offspring will be hemoglobin homozygous? So in this case, I'm just trying fast, he will be only 25, right? So it is 25. Here, a 32-year-old woman with a sickle cell anemia was admitted to the A&E with recurrent painful episode and severe anemia. And this hemoglobin profile will show this. What are the hemoglobin abnormalities? So you can see here, F is high, and you can see the A0, which is A1, the same A1, A, okay? They are a little bit low, not a little bit, oh, it's very low. And A2 is a little bit high, A2 is a little bit high, huh? And I think they meant by this as maybe hemoglobin, I don't know what they meant because they didn't write it. Let's see. Yeah, here you will have hemoglobin A2F, hemoglobin S. Okay, good. Hemoglobin S. What is your diagnosis if you are having a high S and a high A2 and a very low A0? It is the beta thalassemia. What is the basis for your diagnosis? Hemoglobin S is high, hemoglobin A2 is high, and low hemoglobin A0. This is a 4-year-old girl. She's having coming from Asia, and you need to comment on the diagnosis. Of course, here you have hemoglobin ES, right? And compound heterozygous. How you can explain the hemoglobin E? Hemoglobin E is very common for Asia. We didn't tell you about it. And if you remember, the hemoglobin E, we classify it, and this is inherited in Asia parents, right? So there will be a substitution between glutamine and lysine. The clinical manifestation, very, we call it about the pathology, which is mild hemolytic and in early stage of development. And yeah, that's it.